Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rankus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you, everything from nutrition and mental health to alternative therapies and natural living.
We'll bring you the expert interviews, insightful discussions, and practical tips to make motherhood a little easier and help your family thrive.
Please keep in mind that this podcast is for informational and educational purposes only and is not intended to replace the advice, diagnosis, or treatment plans you have with your personal healthcare team. Please have a conversation with your trusted healthcare provider prior to making any changes or implementing any strategies or advice you learn from this podcast.
Whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Here at the Motherhood Alliance podcast, we challenge the status quo, ask the tough questions, and offer a supportive community for moms who want to make an informed, holistic choice.
Thank you for joining us on this journey.
Let's get started. Hi, we are Britt and Andrea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Sara Lindgren, a registered nurse, functional nutrition professional, health restoration coach, assistant professor of nursing, and the owner of Inspire Wellness NEW. With over 20 years in healthcare and a passion for functional and integrative wellness, Sara helps people uncover the root causes of chronic illness and guide them towards stronger, healthier bodies. She's all about practical foundational habits like sleep, nutrition, and movement that empower the body's natural ability to heal. And I will say, we go pretty in-depth in the science side of these episodes because, like I mentioned, she's a professor, so she really knows her stuff. When she's not coaching or teaching, you'll find her staying active, enjoying family time on her boat, cheering on her 3 daughters at their music and sports events, or traveling with her husband, Tim. It's time to turn up your volume. Let's welcome Sara to the mic. Hello, everyone. Welcome back. We are on episode 3 here with Sara. If you missed our first 2 episodes, I am going to highly recommend that you hit pause and you actually go back and listen to those. This series is not necessarily building on itself, but it kind of is. I mean, we've been kind of reverting back to and discussing the episode 1 in all of our episodes so far. So today we're talking about autoimmunity. Let's start high level. Sara, what is an autoimmune disease or disorder?
So autoimmune disorders mean that your immune system is actually targeting what should normally be healthy tissues within the body. So instead of your immune system maybe targeting a bacterial infection or something that you actually want to get rid of, it's actually going for your own self tissues. And again, for a lot of reasons that we don't necessarily understand. So we just treat it in a very conventional way, and we don't actually look at the root cause of it.
Can you give us some examples of what are some commonly heard of autoimmune diseases?
Yeah, so one of the most common autoimmune diseases is Hashimotos, which is a hypothyroid condition caused by an autoimmune response. There are a plethora of autoimmune disorders out there. There's Rheumatoid Arthritis is another one. Lupus is another one. Graves' disease, which is actually a hyperactive thyroid condition, is another one. Multiple sclerosis, which affects the nervous system. Guillain-Barré, which affects the nervous system as well. There's just I've heard on a podcast the other day, I forget the exact number, but I feel like there's hundreds of diagnosed or known autoimmune disorders out there now.
So it just, the diagnosis itself is really just telling which area of the body is attacking. You know, like you said,
Correct.
MS, it's like more the nervous system, whereas Hashimoto's is more of the thyroid.
Right.
Okay.
For example, type 1 diabetes is most often autoimmune. So again, that's attacking the pancreas. Yep.
Okay. So are these disorders something that you have genetically, like in your genes, and they can either be like turned on or off sometimes based on lifestyle? Or is it something that you can, like anyone could develop?
I think the thought is for most of them, there's a genetic predisposition, especially, for example, type 1 diabetes, there's a genetic predisposition. And like you said, if you have that, of course, it's more likely that you're going to have maybe a gene turned on or off that is then going to develop into that disorder. I can't say for certainty that every autoimmune disorder is linked to a genetic predisposition, but I know that the kind of consensus out there is that most often it is some sort of hereditary predisposition combined with environmental factors. But a lot of times most often those environmental factors play a much bigger role than your genetics. Your genetics make up about like 10%, for example, of what you develop later on in life. Most of it is our environmental exposures and our lifestyle.
So when we talk about environmental, what's that list?
So toxins you're exposed to, for example, people that live in urban environments versus rural environments might have higher exposures to certain toxicities in the air. It can be infections that you've had, in the past. Like, for example, Guillain-Barré is associated, or a lot of cases develop after like a flu or a GI viral infection, something that's turning your immune system off turning your immune system on. And then along that immune response, something goes haywire, for lack of a better way to say it. It could be heavy metals. Maybe they're exposed to in the water. It could be a food that we eat or something that we drink. For example, especially in females that develop Hashimotos, gluten is a pretty common trigger and we can't say cause because there's not necessarily causation, but it's highly associated with the onset of that. Dairy for some people can be a trigger. So it can come from food, water, air we breathe, an infection you had in the past, something that's really turning on that immune system. Okay. And typically by the time you develop an autoimmune condition, your immune system is already hypervigilant. It's hyper kind of turned on for one reason or another that we may not even know about. We may not be able to pinpoint exactly what kind of overstimulated it. A lot of times it's a lot of compounding things over time. But then that last trigger kind of gets in there and causes that.
I find like when you say it's compounding over time, that's a lot. That has a lot to do with a lot of things, right? So
100%.
It's not like, oh, I'm healthy one day, and then all of a sudden I got rheumatoid arthritis the next. Like there's a process.
Right. Things are happening under the surface that we just don't know until it's bad enough where your body can't contain it anymore and you become symptomatic. I always say, think of it, it's like your body's a rubber band. You can stretch it and stretch it and stretch it. And if you stretch a nice new rubber band, it's going to fly across the room. Right. But if you stretch it and stretch it and stretch it and stretch it, and then stretch it out, it's not going to fly across the room because you've overstretched it. You've overstimulated it. It can't do anything anymore.
Mm-hmm. I feel like in the past, a lot of these were considered lifelong.
Yes.
But now
it still is considered lifelong to traditional.
Traditionally, most of them are. Guillain-Barré is kind of the exception, but yeah.
Yeah. So then it's like, oh, now we just have to manage your symptoms, right?
Yes.
So here's a pill for that.
The conventional treatment is to give treatment or medications that are going to blunt that immune response. And while that can help with that autoimmune response, because we don't want that immune response, just knocking away at our healthy tissue until it doesn't work anymore. So acutely, that it's a good thing to do those treatments. But long term, if you blunt your immune response too much for too long, now you're at risk for, other infections maybe or other illnesses that your body would normally be able to fight off if your immune system was as robust as it could be. So what we really want to do is find out, if we can, what is triggering the immune response to see that tissue as something that has to be gotten rid of, if you will. So for example, a lot of times Hashimoto's, a common trigger can be gluten. And the reason is, as your body breaks down gluten-containing foods, there's certain gluten proteins, if you will, that are a byproduct of breaking down that gluten. And if you don't break it down fully, sometimes it could be because of lack of stomach acid, lack of just not chewing your food as well. So by the time that food is hitting the stomach and then moving into the digestive tract, it's just not broken down fully. So first of all, that can trigger a hypervigilant immune response in the gut. But also if your body just doesn't like gluten for what, could it be genetic? Could it be something else? Sure. Not exactly sure why so many people are intolerant to gluten. And side note, you can be intolerant to gluten and not have celiac. Celiac in and of itself is an autoimmune response specifically to gluten. You can be intolerant, meaning you don't like it. It overstimulates your immune response without actually having celiac.
Okay.
So let's say we're intolerant to gluten. We're breaking it down, but gosh, our immune system just doesn't like it. There are components of your thyroid cells that look very similar to gluten. So we call it a molecular mimicry. If your immune system is attacking one thing, But then this other thing looks very similar and it starts attacking it. That's molecular mimicry. So if it doesn't respond well to gluten and it starts to see it as something, I don't like it, let's get rid of it, it can start to see those thyroid cells then as, oh gosh, I don't like that either. It looks really similar to this thing over here. I'm going to get rid of it. And that can lead to some of that autoimmune dysfunction. So if we reduce the intake of gluten, it can help dumb down that immune response, which will then make it less hypervigilant against that thyroid as well, because it's starting to become less hypervigilant, less self-destructive, if you will. So that's one way autoimmunity can develop is some of that molecular mimicry.
I love the message now that people are getting that autoimmune disorders don't have to be lifelong. But once you put something into remission, whether it's Hashimoto's or something else, does that person almost live in fear that it's going to come back? Like, does it almost feel like it's like this little monster that you like put into a cave, but it's still there? Is it still there, or is it gone, or how does that work?
Well, if there is truly a genetic predisposition, there could always be a chance, that something could come back, especially in time. So if you ever look up chronic disease in general, especially autoimmunity, one of the treatments or the lifestyle factors that is recommended is to try to reduce stress. We just don't always go into how do we do that, because that's a really big bucket. But the reason is because acute flares of stress can bring out, if you will, that hidden autoimmunity. It can cause a flare. It's just like if people have, so for example, Crohn's disease, ulcerative colitis, very commonly they're autoimmune in nature as well. So when I had a flare of my Crohn, I had to go to the hospital and get antibiotics, or whatever it might be because they had a flare. Well, what caused their flare? Usually it's some sort of stressor, whether it was an infection or something physical or maybe something psycho-emotional. Stress can bring that out. So yes, it can come back or it can flare, especially if there is that genetic predisposition, or especially if you know the trigger and you're exposed to it again. So let's say that I know that gluten was a big trigger for Hashimoto's. Well, if I start eating that again, it might flare again. We don't want to reintroduce that trigger if we know that that's what causes the flare, or we don't want to reintroduce that stressor if we know that that's causing the flare. And sometimes it's hard to do. I mean, you might eat something that you really didn't realize had a certain food thing in it.
Yeah, that's hard.
Or gosh, I couldn't avoid that stressor. I didn't know it was, I didn't know my family member was going to die, or whatever it is that stressor was. Sometimes you can avoid it, but we do know that acute stress can cause flares. Yeah.
Are there different types of gluten? Let's just sit on that train for a second, because especially for somebody who's dealing with autoimmune, sourdough is a really big thing right now. Supposedly that's a bread that has a little bit less of a gluten content, although it's still there. If you mill your own flour, are there ways that you can decrease the depth of gluten,
the density,
and
does it matter?
And does it matter for when it comes to an autoimmune disease, as well as dairy? If you're getting an organic dairy product or raw milk or things like that, are there differences in the nutrition, or is it really just the molecules themselves that the body would be attacking in these types of instances?
Well, it depends on each person. But yes, there are different types of gluten-based proteins. So for example, in the stool test that I do, not all of them offer these, but the one that I use does actually test for a couple different proteins that are gluten-based. Now, again, that's in the stool. So it can be negative in the stool, but unless I check the blood, I don't necessarily know what's in the blood too. So, I mean, it is best to check both of them. And with dairy, yes, there's whey proteins, there's casein proteins. Not all of those exact same proteins are found in all the same types of milk. For example, cow's milk might have casein protein, whereas sheep and goat milk, I can't remember if they all have whey or if they all have casein. One of them is lacking either the whey or casein. I can't remember which one. But so, I mean, depending on what you're sensitive to, you might be able to have a type, for example, of dairy, but maybe not just cow's dairy, for example. And I do know, I'm not an expert on this, but I do know that there is a difference between an A1 type of casein and an A2 type of casein.
Okay.
That comes from dairy. Cow's dairy. And in the US, most of our cow's milk is produced, I believe, with the A1 casein. And I just listened to a podcast on this and I can't recall everything about it, but A1 casein, I believe, is just more inflammatory or intolerant to a lot of people. And I believe it has to do with how the lactose in our system breaks it down. So there's more kind of coming out on this A2 casein, but it is more expensive. I actually went to the farmer's market this last summer and someone was selling A2 milk and it was like $20 a gallon. It was so expensive.
Interesting.
But yeah, so it's not like just the broad term dairy, you know, it's the proteins and things in there. And with that, there is a difference, you know, as long as we're on dairy, there is a difference between like a food sensitivity that could maybe cause trigger maybe an autoimmune condition versus like lactose intolerance. So lactose intolerance means that you just don't have that lactase or that enzyme that breaks down the lactose, which interestingly can sometimes be tied back to the gut as well because your gut lining, those cells actually can help produce the enzyme that breaks down lactose. So if you have a lot of inflammation in your gut, it's not going to probably produce that as well. Now there's some inherited predispositions to that as well, but so yeah, it's not just a broad like, oh, I can't have all dairy or I can't have all gluten. I mean, yes, there are different proteins and things in there that one person might be more sensitive to than another. But interestingly, I did have a student several cohorts back who said that her dad has had rheumatoid arthritis for a long time. You know, they never necessarily knew what triggered the onset of it, but he did know that every time he had anything dairy-based, it would cause a flare of his rheumatoid arthritis. So by staying away from that, he was able to keep his symptoms better. Yeah.
Oh,
Okay.
man.
One question we didn't ask yet that kind of goes back to high level for autoimmunity is how are these actually diagnosed? Because is it through like a blood test and a blood test will come back and be like, whoop, 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 Hashimotos? Or is it really symptom based? Because where I'm going with this is once you receive a diagnosis, especially if it's common for like a gluten intolerance or something, you can start putting that into your diet. But otherwise, it's a lot of trial and error with your diet to figure out what works for somebody and what doesn't.
Yeah.
So how are these actually diagnosed? And then how does that relate to like what you're actually implementing for the plan?
Yeah. So every disorder is going to be a little bit different. But in general, they're testing for autoantibodies specific to that disorder. So for example, if I'm testing someone for, they came in, they've got this, array of symptoms. I wonder if it's their thyroid. We'll do a thyroid, I should say a very robust thyroid panel. Typically what you get conventionally is maybe just testing a TSH, which doesn't even come from the thyroid. It actually directs what the thyroid does, or at least it helps direct what the thyroid does, but it doesn't even come from the thyroid. So there's a lot of different things that we should be testing for the thyroid, but one of those is there's two different types of thyroid autoantibodies, they're called. So if they're present, especially if they're present in, higher amounts, that indicates that your body is producing some autoantibodies, which is what is attacking that particular tissue. In rheumatoid arthritis, there's different types of autoantibodies. For example, in lupus, there's different things. I mean, just the broad category, they're called autoantibodies, but there are very specific ones that you can look for depending on the disease process that you're testing for.
Mm-hmm. Okay. And then once you get the diagnosis, then kind of the game plan is kind of laid out. You can kind of, for the most part, you know what to start trialing and erroring.
Well,
right.
I mean, it depends on who you see, I would think too. If you go to a traditional doctor, they're only going to test for so much. And then they're going to tell you, hey, you have this and here's some meds. Yeah.
And it truly depends on the disorder. You can't really put all autoimmune disorders in a big bucket because, for example, if I have type 1 diabetes, which most often is an autoimmune response, that's going to be treated very differently, of course, than someone with Hashimotos. Someone with type 1 diabetes, they're going to have insulin and dietary restrictions and things like that. With Hashimotos, very often, your thyroid isn't producing enough, so we're going to give you, typically it's like levothyroxine, which is a synthetic thyroid hormone, which, it's going to boost your hormone, but underneath it all, your own thyroid still isn't making it.
Yeah,
so
there's a root
what
issue
is it?
Here. Yeah.
Right. And so with rheumatoid arthritis or lupus or things like that, I mean, the treatment can be very different depending on the person. But ultimately, a lot of times those patients or patients with inflammatory bowel disease, which is like Crohn or ulcerative colitis, they'll go in periodically and they'll get immunosuppressant infusions, to try to dumb down that immune response. Which again, acutely, if your immune response is what's hurting you, you want that support, but underneath it, we really should be looking to see, well, can we figure out what's actually causing this?
Yeah. Right.
And that's where we kind of lack in that investigative piece most often.
the traditional medicine is great and it's good to have.
100%.
Obviously,
Yep.
There's times and needs for it. But I, and that's something that's why we have this podcast, is we really want to just make people more aware of services like that someone like you offers, where you can really just dig deeper into what the issues are. And it's just too bad that we don't see that more in traditional. Mm-hmm. It's just a Band-Aid approach. They're not digging deeper necessarily. Some do, which is great. But it's just so great that we have people like you that can help with this. Mm-hmm.
Yeah. If you're not trained functionally, you don't know what you don't know,
right?
Which is part of the issue. But yeah, I mean, I worked in the ER, like I said. I mean, if I'm having a heart attack, I want somebody to acutely do something for it. But our acute care is phenomenal, but our chronic care is very, very lacking. The trajectory of chronic care just continues. Or chronic disease, I should say, just continues to go up and up and up and up.
Right.
And it's just, there's no end in sight.
Yes. So I hope that something changes someday, and that more chronic care is, better overall, and people are more aware of these things. But for now, we're just going to keep spreading the word.
Well, and we had talked about how oftentimes autoimmune disorders are slow grind of different things that are leading up to ultimately the symptoms. Bam, all of a sudden, all these things have added up. I'm assuming reversing these is also going to be a process.
Yes.
So I know every person is different. Every autoimmune disease is different. But like in general, if someone were to come to someone like you and is like, okay, I want to do this the right way. I want to get to the root cause. Just so that they kind of know what to expect. Is this like for sure plan on at least 6 months, plan on a year of, how do you, when you have a baby, 9 months in, plan on at least, I would,
it's more than 9 months.
Typically they say 9 months. I'm going to say 18 months before you start even thinking beyond. You just have to respect the process. So what would you say to someone on like length of journey? Just be prepared for when it comes to reversing these things.
I would say at least a year.
Okay.
Depending on how long they've had it too. Because part of that time you're trying to figure out what's causing it, and again, you may or may not be able to figure it out. But in the meantime, we have gotten so far away from just basic things to help our health. Like we talked about, in prior episodes, do we sleep?
Yeah.
And do we have a good quantity, and do we have a good quality? Because again, let's say that you're fighting an autoimmune response. Like I said before, you can't heal from anything if you don't give yourself that recovery time. And that includes autoimmunity. What are we eating? Sometimes it's a buildup of these toxins in highly processed foods that is kind of that tipping point for that immune response. Because like I said, we talked about molecular mimicry being a potential trigger for autoimmunity. But another thing is, going back to episode 2, let's say you don't poop every day. You're not eliminating those toxins. Those detox pathways aren't working. Or you have fatty liver, which a lot of times people poo-poo. Oh, I just have fatty liver. It's fine. No, it's not fine. It's completely clogging up your detox pathways. So if there's anything bottlenecking those detox pathways and you can't eliminate them, again, they'll get back into circulation, and your body's like, well, I don't know what to do with these. What do I do with all these things I don't want circulating? Oh, I know. Again, I'll store them in the thyroid. I'll store them in this lipid-based brain. I'll store them in these different tissues, because then at least they're taking it away from the rest of the body. Or I'll store it in this joint. This joint over here looks pretty good. And so then those tissues look different because now they're storing toxicity. And so the immune system's like, oh man, I better do something to that joint. Well, what is rheumatoid arthritis? Okay, a lot of it is inflammation of the synovium of joints. Okay, it's an autoimmune inflammatory response, and it directly affects the joints typically first. What is Graves' disease, Hashimotos? It's attacking the thyroid. What is MS? It's an autoimmune response attacking the brain, or attacking the central nervous system. So again, part of it is, it could be a molecular mimicry, or it could be like, hey, we're just storing these toxins in these tissues because we don't know what else to do with them because you can't eliminate them. And that's kind of your connection with a lot of autoimmune disorders in the gut as well. So yeah, and because of that, a lot of that initial time is like trying to figure out what could be causing it. And a lot of times it is multifactorial. And then doing the basic things, which is sometimes hard because, if we're used to eating a certain way, or we're used to going to bed at midnight versus maybe 10 o'clock, or we're used to never taking time for ourselves to really get into that rest, digest, and heal stage. Sometimes building those habits take time as well. So it is a process. And we always say you got to, have gratitude and be grateful for the process too. I mean, and there's a big mind shift that has to happen too.
Right.
Because so much of this is driven by our negative self-talk, and maybe not necessarily driven, but contributed to by our negative self-talk and our thoughts and things that go through our head 24/7.
Oh my gosh. And society too, pressures, like, oh, they're eating those hamburgers. Why can't I have that? Or whatever it is. It's
100%. And it's because
hard.
we are all so different. We all have different makeup. We all have different life experiences and exposures. And it just goes into who you are as a unique person, but that's why you respond differently.
Right. And you have to be able to, do things a little differently for yourself, which might look different for everyone else. So,
Well, thank you for sharing your knowledge in another in-depth episode. I'm learning a ton. I am loving these episodes. I do want to mention, you guys, that Sara does offer a free 30-minute discovery call. So if you want to talk more about autoimmunity, or if you're having symptoms or you know somebody who is and you want to direct them toward her, please go ahead and book that free 30-minute discovery call. You can do it primarily through her website. What is your website again? InspireWellnessNEW.com. Perfect. All right, you guys, we have one more episode. We're going to be diving into bioactive peptides. I know for me personally, I've heard of peptides. Yeah. I've never taken peptides. So I'm really interested to learn more.
Me too.
Yeah. And so this is going to be a great last episode with Sara. We can't wait. If you enjoyed this episode, would you consider leaving a rating or review, or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.